Hi, I'm going to straight cath my patient. I have already done hand hygiene and put on clean gloves. I also already ID'd my patient and talked to my patient about the procedure and answered any questions. She asked me if this catheter was going to stay in for a period of time. I told her no, I will take this out right away since it is a straight cath versus a Foley catheter. I also positioned my patient, washed her perineal area with soap and water, and pulled the curtains for privacy. So now I'm getting prepared to open my straight cath kit. I'm taking off my clean gloves. Everything inside this box will remain sterile. So you want to carefully open it. I could touch the outside. Throw that away. So this does not have to stay sterile. This is just a drape to put down so we don't get any urinary leakage on the bed. I'm going to put the shiny side down. Just put this in between here. Again, that does not have to stay sterile. Now I'm going to take my sterile gloves out. And I'm going to put my sterile gloves on. I now have my sterile gloves on, and I could touch anything in this container because I have sterile gloves and everything is sterile. So I can throw some things away that we will not be needing. We don't need this sample cup for today, so I could throw that away. This is a fenestrated drape, so it has a hole in it. I'll show you. So what you would do is you could place it on top so only what is showing is what you would need. We don't need this for today. It kind of gets in the way. Next, I'm going to take out these swab sticks. You can either loosen them, just leave it like this. I prefer to take them all the way out just so they're ready and kind of lean them up against the side. I will then lube the tip of the catheter by opening it, grabbing this tip, and putting it in by being very careful because, again, everything in this box is sterile and it needs to remain that way. Now I'm going to transport this over there. So I cannot just grab it because on the outside it's not sterile. So to transport it, I'm going to have to put my hands inside and kind of push up against it to carry it this way. So now I placed it there. Now I'm going to designate my non-dominant hand as my non-sterile hand and keep my right hand, my dominant hand, as sterile. I'm going to open the patient's labia with my left hand and keep it open until I am done. So I'm going top to bottom on the left side, throw it away. Top to bottom on the right side, throw it away. And top to bottom down the middle, throw it away. Now I'm ready to insert the catheter. It's already lubed. I'm keeping this open. I'm going in the urethra. It's sometimes hard to get in, so just wiggle it around. Now I'm sliding it in. Once I get urine flow, I'm going to go in just a little bit further, and I can let go at that point and let the urine flow into this. Once this has finished flowing, I can tell the patient that to take a deep breath because I'm going to pull it out, but I'm going to wrap it in my hand because I don't want this. It's going to have urine on the tip, so you don't want to fling this all around everywhere. So now I'm sliding this out by holding it in my hand, and now I have it in my hand. I'm going to keep it in my glove, wrap it in the other glove, and dispose of this in a biohazard container. I then can wash my hands and put clean gloves on, or I can just take this up, and this is going to have urine in it, so I don't want to spill it, and I will have to document the color and odor and the amount. After that's done, I can reposition my patient and clean up my workspace.